So good to have you here today. So Michael, I'm going to put up your little slide here so everyone can get a good look at you. I'm sorry that we can't have you on camera today, but our studio facilities have been destroyed from a lack of power. So we're all kind of just working on the phone here. But thank you so much for being here today.
Yeah, thank you for having me. That's cool.
And thank you for coming out to the conference. We mentioned a little bit about Shedlight earlier as we were running through the sponsors of the conference. Shedlight was actually a sponsor of the NORA conference that we did a few months ago, and so we got to learn a little bit, sort of all about their cold laser. But maybe you could give us a little background about you and your practice and sort of your perspective and what you do and how you can work the laser into your practice.
Yeah, I have a couple of clinics. I work with Life University up in Atlanta, Georgia, which is the largest chiropractic university in the world. And we have a specialty clinic, and it's applied clinical neuroscience, or what's known as functional neurology. So we work with cases of dysfunction from every range of neurodevelopmental stuff with kids that are a little bit behind the curve, all the way through concussion, athletes, performance enhancement, all the way up to neurodegenerative diseases like Alzheimer's and Parkinson's. And it's receptor-based therapy is the way that I've often described what we do. And if you have a receptor in your body, whether it's the light receptors or photoreceptors in your eyes or joint mechanoreceptors in your joints and muscle spindle fibers in your muscles or touch receptors on your skin, we're going to use them to affect neuroplastic change. And a lot of times we can restore function to a person who has lost function from whatever it was, a brain injury, developmental issues, toxicities, or things like that. And then we can also enhance performance for people that are trying to take it to the next level, like athletes. And, being part of the university, we work with a lot of really high-level collegiate athletes with rugby and basketball and things like that. So I have that practice there. And then I also have a private practice down in Jacksonville, Florida, where we use very similar techniques to work with a very similar patient base.
Got it. Great. So I guess the big question is, at NORA, we spoke with Dr. Griswold for quite some time about, sort of the idea behind cold lasers. And, I confess, this is something that I was completely unfamiliar with. And I know Steve also and Paul also totally
Yep.
unfamiliar with this. But maybe you could walk us through again for those who are unfamiliar with this. We have a lot of students here today. I think about a third of the people that registered are students in eye care. They're student optometrists and so forth. Maybe you could walk us through this whole process of what these cold lasers are and how these things work.
Yeah, sure. So laser, just to kind of keep it short and simple and not get too nerdy into frequencies and numbers and all of that stuff. Laser in general has been shown in literature and in research consistently to do three main things, I think, that will help with what you guys are doing and with healthcare in general. But it's been shown to increase the number of mitochondria in a cell. Mitochondria being the powerhouse of the cell, that's what kind of makes cells do what cells do, right? Whether it's, whatever that cell's job is. If it's a neuron, it's to send information. If it's a muscle cell, it's to contract. So research shows that lasers can increase the number of mitochondria or powerhouses in that cell. It also increases blood flow to that area. And we know that blood brings all the essential nutrients, again, for cells to do what cells are going to do. And it also clears out all the waste products. And both of those things are key for different reasons. And the last thing it does is it improves membrane stability in a cell. So we can exercise cells harder by giving them more nutrition and giving them more power. And then we also don't get as much cell breakdown when we're utilizing a laser in what it is that we do. Now, we can get really nerdy, and there's all sorts of, and with the Avant laser through Shedlight, there's all sorts of frequencies that are in there that have been studied and researched and programmed in, so you don't have to, become a mathematician to learn how to do that. But each frequency is how cells communicate. I always go back to brain waves because I think that's something that most people hear a lot about right now. If you look at difference between like beta waves, which is your the way the cells communicate to do work, versus a delta wave, which is what the frequency is that cells use to go to sleep. And any range in between to get things done, you can actually set very specifically with that laser. So that's how frequencies and numbers can also play into improving blood flow, improving mitochondria. You can put things into a certain state, which for us has been key as to how we utilize the laser. And depending on whether we're trying to exercise somebody or if we're using it to help them calm down, relax, and regenerate, we can use those different frequencies that are programmed in there.
Got it. So, I mean, maybe you can give us like a clinical example of how you might use this laser. Because I mean, even just looking at it, I can put up a picture of it just so people can see what this thing looks like. Maybe just step us through. Maybe it's just what does a typical patient encounter look like, and how do you actually use this?
Yeah. So for concussion is a big one in athletes. One of the things with concussion, and especially you guys work, I love what optometrists do and neuro-optometrists do, Nora, what you guys do with the eye exercises to help along with the concussion case. But one of the hallmarks of concussion is that they fatigue out really, really quickly, right? If you try to do too much activity with them, you start to get a return of symptoms like dizziness or, a headache or eye strain. So what we can do, well, first of all, what we know from that is that when you damage the brain, there's a decrease in what we refer to as the metabolic capacity of that brain, meaning it can't do as much work before it gets tired, right? So again, going back to what the laser does well is it increases blood flow, it increases mitochondria. So it gives us the ability to increase that threshold while we're working with somebody. So now if we're going to do, we do a lot of pencil push-ups or clocking, in our practice, just as kind of a basic eye exercise to start the process. We usually would have people fatigue out really, 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 really quick. So they might only be able to do 5 passes for convergence, and maybe, they could get from 12 o'clock to 6 o'clock before having to close their eyes and take a break. But if we utilize the laser on the brainstem, as well as on different parts of the brain, we can actually increase their capacity before fatiguing. So we might have a patient who was fatiguing out really quickly. So we'll use the laser and it's super quick. Like we'll do 30 seconds on each part of the brain. And there's about 4 spots that we hit, and then have them go do their eye exercises, and they can push through a whole set or even 2 or 3 sets without fatiguing, whereas they might have been fatiguing prior to that. So that's kind of how we use it, is to give them some more energy, some more activation. And then when they have that blood flow, when they have those mitochondria, it's a lot easier for the brain to accept that new pattern or create neuroplastic change because it has more resources with which to do that.
Got it. And I guess one question that I had about the laser itself, how far can it actually penetrate tissue, right? When you're applying it to someone's skin, right? How far does it go? How deep?
Well, through the skin, it goes super deep. So it's kind of like a diathermy. It's cold laser, but it's still reverberating at different frequencies, and it can go to depth. I mean, it'll go all the way to bone. And you can actually, that was one of the first utilizations for cold laser therapy, was for bone regeneration. So we know that it goes at least into bone, and it'll actually penetrate pretty far into bone through the periosteal layers. And in the skull, it'll penetrate all the way through the skull to about 1/8 or 1/4 of an inch deep into neurological tissue or brain tissue, depending on which bone you're going through. So the temporal bone is more porous, so you can get a little deeper utilizing red light therapy or lasers over the temporal bone than you can, say, over the frontal or occipital, but you can still get a good distance into the gray matter going through frontal or any of that kind of stuff.
How does it work in terms of optometry and the licensing? I know certain states, Kentucky, Oklahoma, and a few others can do hot lasers. Is there any limitations on a cold laser in terms of licensing in other states?
It's hard for me to speak to that. I know in Florida and Georgia, there is no issue with licensing as far as cold laser goes, because cold laser has less things that you can damage. The hot lasers or other things like that, there's much higher risk associated with those. So there's a lot, stricter licensing rules. But I know in the 2 states that I'm practicing in, there's very little restriction on cold laser therapy.
Okay,
Great.
if I get down to Boca, we'll have lunch together and talk about it.
Are you down in Boca?
Right now I am, yeah.
Nice. I'm only a few miles north of you up there in Jax.
Well, great.
So I guess and I'm jealous of all of you guys right now, actually, as we're freezing to death up here in Portland. But anyway, my final question for you, Michael, though, is, cost. I mean, I know that, you're just a user of this laser. Do you have any sense of how much it actually costs to use or to acquire the laser? And what is sort of the maintenance you have to do? It looks like it's a solid state device, right? So I can't imagine there's too much in the way of maintenance.
No, there isn't. And that's, honestly, that's what set ShedLight ahead of everything else. It was, one, the cost of the laser. Some of the lasers that I was looking into were $12,000-$14,000. This one, I think out of the package you can get it for about $7,000. But when you order it through ShedLight, what I didn't get from any of the other companies that I was looking into, and I'm not going to name any names, was the support. That's the one thing that's why I'm close with Damien, because he answered the phone and text messages whenever I had a question or a problem. He was always there to kind of troubleshoot it with me and walk me through it. And I've actually had some pretty severe TBI patients that I've recommended they get a laser themselves, and they have, because it helps with their regeneration long term. And he's been there to kind of walk them through all of it and show them exactly what settings, because there's about 400 different settings on the laser, and it can be overwhelming for people and even for doctors. So that was one of the things that set them apart. It's about half the price of what a lot of the lasers cost, and you get twice as much back in support and help with troubleshooting and utilization of the technology.
Wow. Excellent. Well, then I would encourage everyone to head on over to ShedLight's booth, take a good look at it, contact them, and give it a shot. So awesome. Well, Michael, thank you so much for being here today. And I guess if anyone has any other questions, we'll pass them along to you.